Well, that depends on which operation you're having and the experience of the surgeon, obviously. The gastric band, very quick. It would typically take me 30 or 40 minutes to do a band operation once the patient's ready for me to start work. The gastric bypass, more complex, obviously, with the join-ups and everything we have to do, and that would typically take about an hour and a half, sometimes 2 hours to perform laparoscopically. Some patients who are high risk, we feel that 2 hours is too long really for an anaesthetic, and we'll often recommend they have a sleeve gastrectomy as the first stage in what we call a two-stage gastric bypass. And this is because the sleeve is actually a really quick operation. Although it's more complex than a band, it still only takes about an hour to do, and that's a much shorter, safer anaesthetic. So if you're particularly heavy, say with a body mass index in the 70s or 80s, we'd be saying to you, look, have a sleeve as the first step, lose a substantial amount of weight with the sleeve, and then a year later, we can always go back and convert the sleeve into a full bypass when you're lighter and it's safer if that's necessary.